Antares Plus has a module for the dry eye report that is a comprehensive report of the dry eye condition, and it's possible to create this module directly from the patient file in this way. So clicking the right button of the mouse and create the new dry eye report. Here you can see all the sub-modules of the dry eye report. So I can, for example, fill directly the questionnaire. This is one of the most important questionnaire to assess the symptoms of dry eye, so the ocular surface disease index. I can ask the different questions, so the different items directly to the patient and record these items. Then I can move to the, for example, ocular redness. I can both acquiring directly from the dry eye report or import this exam from the gallery in which I can find, for example, an exam that I previously recorded. In this case, I'm recording, I'm acquiring directly an exam. So I can ask the patient to look on the left, please, okay, and I can remove here the Placido disc lighting brightness that is quite noisy, and here it's quite good to get images from this system. Then I can move back to the dry eye report, and again I can acquire an image of the meibomian glands. Please look straight, okay, or look up, yes, please, okay, and I can acquire again the meibomian gland here from the lower lid and move back to the dry eye report. Again, I can acquire a tear meniscus and measure the height of the meniscus, so in this way. Oh, okay, there we go. Okay, then move back again. I have now a non-invasive breakup time to complete the reports. So I can ask the patient to look the light, then blink twice. So please blink twice again and keep the open as long as possible, the eyes as long as possible open. Fantastic. Okay, there we go. So I have a preview of the non-invasive breakup time here, and I can then analyzing later on with the system. Finally, so the report is quite completed. I can set the osmolarimetry that actually have to get with another instrument, and I can report the level, so the measure of the osmolarimetry here, and that's it. And I can do for the left eye. So finally, I have all the exams that compounds the dry eye reports in an overall report that is meaningful for the clinician. So we are now within the dry eye report module of Antares Plus, and what's the rationale behind this kind of module? This module has been built according to the TIFOS 2017, so the diagnostic report of TIFOS about the dry eye disease, so the DED. So as you can see, the report here is integrated together different kind of assessment, something that is directly get from the test and assessment that the machine can provide, and something that can can get from the interaction with the patient, like the questionnaires, or with the for example other examination as the osmolarity. So the TIFOS report says that a dry eye disease should be diagnosed by different kind of results. For example, the symptoms should be above a certain level. The ocular redness, so the ocular surface reaction to the dry eye, is a part of the reaction of the eye, and also the stability of the tear film is something that is part of the diagnosis of the dry eye disease. But also, according to the classification system and the battery of diagnosis, you should look at the differentiation between aqueous deficiency, dry eye disease, or problems with the lipid layer that is probably due to something, some issue with the meibomian glands. So let's have a look what happened, for example, in the questionnaire. If I selected here the questionnaire, and for example, here you see a form that has been filled by the patients, and the ocular surface disease index is a very established test questionnaire in the field of dry eye, and you can check the frequency of the symptoms in terms of quality of vision, for example, or in terms of symptoms with a dry eye, painful, gritty eyes, and so on. Above a certain level, you have above a certain cutoff, you have an alarm in terms of symptoms. Above this, you have the ocular redness that can allow you to, for example, check what happened in terms of let's see, okay, the conjunctival redness, in terms of reaction of the ocular surface. So I can, for example, if I took this image, I can grade this image according to a certain system, and I can grade, for example, I can grade the ocular redness in terms of limbal redness. So what happened around the limbus, always matching the image with a certain grading scales, and also the conjunctival redness. So for non-invasive breakup time, I can check the what I acquire, and here there is the assessment, and the non-invasive breakup time is a way to measure the breakups in the tear film using the reflection of the placido disc on the tear film surface. Here, for example, I can show you the video. So if you play the video, you will see some discontinuation in the rings that represents breaks of the tear film. And the breaks are converted in time. So the time lapsed between the last blink and the first breakup is considered the sensitive measure. And this measure has a cutoff of 10 seconds for invasive systems, or a little bit more than 10 seconds for non-invasive system. So once you get this information, you can see if the tear film is stable or not stable. So that is part of the diagnosis of the dry eye. Let's move back. So once you have measured the ocular surface reaction, the tear film stability, then you can get information about the kind of dry eye disease, and for this purpose you can see at the meibomian glands and the tear meniscus. In the first case, meibomian glands, you can measure, for example, here I previously checked the amounts of meibomian glands still present in the lower lids, and you can do the same for the upper lids, and you can measure how much in the surface analyzed has been lost. So this is an information that can be linked to a deficiency in, for example, lipid layer quality, or usually is linked. And but sometimes the dry eye disease is something linked with the volume of the tear film, and the volume can be established in several ways. According to the TIFOS, the best way to do that is in a non-invasive measure of volume, not with strips and so on. And so the according this report, usually it's possible to do that by measuring the tear meniscosate. When the tear meniscosate is below 0.2 or 0.15 millimeters, usually you can have a dry eye condition, and so you can measure these parts and in several points, and about and this can give you information about the volume. Finally, you can add by the settings the information about the osmolarimetry, and usually a measure of osmolarimetry, for example, above 315 or 320, something that is linked to the dry eye disease. Finally, the clinicians, looking at the overall report, can give a mark to the overall condition. So, and this is something that usually the clinician has to do at the end, like averaging the clinical condition. So I can set, for example, normal condition, or a trace of dry eye disease, or mild condition, or moderate or severe condition. At the end of the assessment and the end of the overall assessment, the clinicians can, as usual, print the output, in which you can find a summary of all the single condition and a summary of the overall condition that the clinician has marked. The dry eye report can also allow the clinician to make a comparison between, for example, different follow-up examinations. So here we have the examination that we have just performed, and I can get another one and see if I have differences in a follow-up period of certain amount of time. And so for each single assessment or test, for example, the OSDI questionnaire, the NIBU, the ocular redness, and so on, I can have information on the right eye and on the left eye, how it's changing the condition. And this is very informative for the clinicians, but also for the patient, because it's quite friendly output of the follow-up change in the eye condition.